Hello, everyone. In continuation of the series that I started, Salute to the Heroes, we have today with us Dr. Shahid, who is a PhD in pharmaceutical sciences and is an assistant professor at the Chicago State University. And he is with us today. Hi, Dr. Shahid.
Hi, thank you for having me.
Absolutely, our pleasure. So, would you like to introduce yourself?
Hi, yes, my name is Shahid. I earned my PhD from University of Delhi in cardiovascular pharmacology. Basically, it's a part of pharmaceutical sciences, so you're right saying that. Currently, I am an assistant professor at the Chicago State University. I have an active research program at the Chicago State, but mostly the research expertise my research interest includes cardiovascular diseases, metabolic diseases such as heart diseases, atherosclerosis, coronary heart disease, and obesity. I think I already talked about atherosclerosis.
Mhm.
And most of my research is supported by the funding from National Institute of Health, NIH, American Heart Association, and previously it was some of the fundings I received from Harvard Medical School as well.
Okay.
Prior to coming to Chicago State, I was an instructor and assistant in pharmacology at Harvard Medical School in Boston.
Okay, excellent. So I'm so happy to have you here, and we wanted a scientist's perspective in what is going on. We are all the world is fighting this pandemic of coronavirus. So I wanted to ask you a few questions about the virus itself for people out there to understand it a little bit better. Why it's like people keep comparing it to flu and other diseases. Why it is what it is. How is the virus different? And the infection that it's causing, and in terms of message to the community, staying social distancing and staying indoors, how that is very helpful. And then we'll talk about certain medications that are being used and trials are being done for the treatment of this, as well as vaccine, a potential vaccine for this. So
Mhm.
can you please tell us about the virus?
Well, okay, just a disclaimer before I start. So as I said, I am a cardiovascular and metabolic scientist. So I'm not a physician, nor I'm an immunologist or a vaccine expert. So please don't quote me on anything what I'm saying here, but this is just for more educational purpose. I'm going to give you a perspective, a general perspective from a scientific approach, right? So, and whatever I have learned over the years about the viruses and immunity and vaccines, I will try my best to give you the correct information as much as I can. So, a coronavirus, as we're talking about, this is in short, it is called SARS-CoV-2. So, if you are familiar with the previous pandemics that happened in 2003 and then in Middle East in 2002, 2012, if I'm not mistaken. It was called MERS. So and this currently is now COVID-19 virus. All these three viruses belong to the same species of virus. We
Right.
call them coronavirus. And we call them coronavirus because they are spherical in shape, but they have crown-like, spikes
Spikes.
around the surface. That's why we call them coronavirus, crown-like virus, all right? Uh, the only thing that is concerning about the current COVID-19 virus is that it's a new virus. It doesn't mean it is the most dangerous virus. It is a new virus. We don't know much about this virus. There is a lot more information that we need to know about this virus before we can develop a vaccine or a treatment or a therapy. Uh, and that is why the researchers and the governments around the world and even WHO and CDC, they are concerned that we don't know the virulence of this virus. We don't know what is the spread rate of this virus at this point.
Right.
So unless we don't know, we don't want to go down the roads. That is something that we don't know. We are not very
Right. When you don't know the enemy, you cannot make a weapon. Yeah.
exactly. So we need to, and scientists are working really hard, and I'm very sure by the end of this year we will know a lot about this virus. And by the end of next year, we hopefully will have a vaccine and some treatments, pharmacological treatments available too. So yeah, don't right now, you don't need to panic. Just try to learn about this virus and try to follow the government guidelines, doctors' instructions as much as we can. But don't panic. It is not as dangerous as it looks. If you look at the infection rate, just to give you a perspective, you know, right now, I think worldwide, if I am looking at the current data, is approximately 2.2 million people who are infected with COVID-19. And if you compare it with the flu, which is, which we don't even pay attention to, almost 1 billion people are infected with flu virus every year. And mortality rate in certain cases could be higher with flu, even though right now it seems much higher with COVID-19, but we need to know how many people are infected actually. We don't know that yet. So it's
Right.
constantly changing at this point in time.
And the testing, so that's the other thing, the data that we don't have of how many people are infected versus, how many are getting a severe illness and fatalities. So morbidity and mortality of the disease. So I think the testing kits not being available widely has also sort of, kept us in a very bad position in terms of, defining. And if we are saying flattening the curve, are we, not testing enough, or is it actually that, so it is very hard to say what we're doing and what this virus is doing. Now, in terms of vaccine, so where are we and what is the, so you are saying there is research, but it will not be, not this year, not anytime soon.
Yeah, I mean, well, when I said a vaccine might be available by the end of next year, I'm still very, very optimistic when I'm saying that. Do you know how much time it takes to develop a vaccine in
Right, it needs
standard
the
procedure?
trials, yes.
It takes at least 10 to 15 years to develop a vaccine by following the regular FDA guidelines and the procedure. Um, but because these are the unprecedented times, very difficult and challenging times, so FDA has also uh, some methods in place through which you can accelerate the development of a vaccine or even a drug for that matter. Basically, around the globe, the researchers are working day and night to develop something. If you could recall, in January, China has already sequenced the virus. In other words, in simple words, we know, what is a genetic sequence of this virus, and that is very important to understand before we can actually develop a vaccine or a therapy. In China has already done that in January, and that played a crucial role in our efforts, what we are putting into right now to, with the ultimate goal of developing a treatment. So 1 week after that, several companies, pharma companies in the United States, they already started working on it. Just 1 week after it was discovered that, how the virus was like. And that is the result of those efforts that China put in place in the beginning. I know people are saying a lot of things about China right now, but they have done some good work also.
Right. And
So
it is
basically,
about helping each other in these times. We are just
absolutely,
supposed to don't reinvent the wheel, take the knowledge of the other person and then go
absolutely,
forward. What
absolutely.
about some of the treatments, in terms of
So
the illness?
if you were to categorize the efforts the scientists are putting in right now, they can be categorized into three major categories, three broad categories, three distinct groups. One is diagnostics, second is treatment, and the third is vaccine. So three categories. The diagnostics are used to diagnose the disease, right? Whether a person has been infected by the virus or not. And if I can say that, I think we have been very successful as far as diagnostics is concerned, because several kits are out there available to diagnose whether a person has been infected with the virus or not. Excuse me. About the second category, the treatment, this is something that we have been struggling most among the three categories that I just mentioned before. The most common drug, I think, I would say, the top running drug right now, as far as the treatment is concerned, is remdesivir. I don't know how other people
Yeah,
pronounce it. Is
Remdesivir,
remdesivir,
yes.
and I think the company is Gilead. They are working with this drug, and originally this drug was developed uh, to treat Ebola virus. You know, the previously few years ago there was an
Right.
Ebola outbreak, so it was developed to treat Ebola. And recently it turned out that this drug can also work against COVID-19 virus, at least in the lab settings. Okay,
Right. And I
they
think they
have
were
not tested
used
it.
with some positive results.
Oh, and actually, they found really good results. When
Mm.
I was reading about this article for your interview, I was very impressed that we have some positive results about that drug. But I was surprised not to see a lot of you know information available about this drug on mainstream media. But actually, this is one of the drugs that we have been seeing some positive results. So uh,
Mm.
that's a good thing. So that is for the treatment. There's another drug that people are talking about a lot is chloroquine, right?
Yeah,
And I don't know why, because chloroquine is an anti-malarial drug,
right.
right? It was never tested before against any virus before. Yeah,
Yeah,
recently it was
yeah.
tested COVID-19 virus,
Mm.
and yes, some of the researchers found some positive results. They got some positive results against.
Because of its anti-inflammation property or
Right, but
something.
this
Yeah,
test was done in petri dishes, right? Not in humans, and not in in the whole organism level, right?
right.
So yeah, so you found some positive results in petri dishes, but uh, how sure you are, how certain you are that it will translate exactly the same way at the organism level? We
Hmm.
don't know that. So there is a lot needed to be done in this area before we can say, okay, chloroquine can be considered as one of the treatments. It's,
Mm.
we are not even close. We are not even close to
Yeah,
that. Okay,
yeah.
it's far away. So the third category, which is the most important category in my opinion, is the vaccine development that I talked about. So vaccine, actually, as I said, it requires 10 to 15 years to develop a vaccine under normal circumstances. But because FDA has other alternative, um, you know, pathways through which you can develop or accelerate the development of a vaccine,
Hmm.
right? So one of the vaccine that actually there are four categories of the vaccine that the scientists are working on right now in order to combat the COVID-19. Okay,
Hmm.
so if I can refer to my notes because I am very forgetful, so I noted down on my paper.
Yeah.
So there are different four categories. First is the whole virus vaccine.
Hmm.
This kind of vaccine contain attenuated virus. When I say attenuated, they are actually weakened. They cannot uh, cause a disease under
Mm. Right.
theoretically, right? I can give an example of this kind of vaccine, the measles vaccine and mumps
Mm.
vaccine. They are live attenuated virus vaccine. Okay,
Right.
so this is one of the things that scientists are working on right now. The second is a recombinant protein vaccine. This vaccine contains only a small part of the whole virus, all right? And
Hmm.
that protein is also not, you do not obtain that directly from the virus. You actually produce it, you synthesize it in the lab,
Mm.
and it represents an exact copy of a small part of the virus, right? We call them recombinant protein vaccine. And the advantage is that because they do not contain the whole virus, so they do not carry the risk of creating a disease or infection by themselves,
Mm.
right? So as an
Exactly.
example, if I can give you that for this is HPV vaccine. HPV vaccine is a type of vaccine that contains recombinant protein, all
Hmm.
right? And the third is the antibody vaccine. Antibody vaccine, I would say it's more like a therapy and not vaccine. Why? Because the way it works like a treatment. For example, what is happening right now, actually recently in the first or second week of March, FDA approved the use of convalescent plasma from the patient who were
Patient who had
infected with
recovered.
COVID-19 previously,
Yeah.
but they did not show they develop none or very few or minor signs or symptoms
Mm.
of the
Mm.
disease. So to a scientist, it suggests to me that these patients must have developed strong immunity against those viruses, and that's why they did not develop the symptoms, right? And how do you develop the immunity? By developing antibodies. So how about you take those antibodies from those people who were infected but did not show any sign
Mm.
or of the disease? Take the antibodies from those people and inject them into the people who are really sick with COVID-19.
Mm.
Maybe, and the idea is if the antibodies are working in one person, it should work in the sick person as well, in other person. That's the idea behind it. And it's,
Mm.
I think, it has been already approved by FDA, and people are working in this
Right.
area as well, very fast, right? The
Mm.
last category, which is also very, very often talked about lately, which is nucleic acid vaccine, that is
Mm.
DNA or RNA-based vaccine.
Mm.
So if you can recall, Moderna Therapeutics or Moderna Pharmaceutical Company in Boston, they recently, initiated a clinical trial, phase 1 clinical trial with a vaccine they recently developed. And they developed so fast in just few months because the technology that they're talking about, it works like wonder. It works wonder. It works magically because what happens in the DNA, RNA, or nucleic acid-based vaccine, you basically inject the genetic material of the RNA
Mm.
into the live host. Like if I'm a person, if I'm a patient, they will inject. Well, you don't need a patient. Sorry, let me correct myself. You just inject the um, genetic material from the virus directly into the host. It could be a healthy patient, a healthy person, or a patient. So
Mm.
what would happen? This genetic material will be converted into protein by our own cells. And then that protein will trigger an immune response in our body. And as a result, if the next time you are infected with the virus, which contains the same protein,
Mm.
the antibody that you had already developed would work against those viruses, and you try to neutralize the virus.
Mm.
That's the theory behind the fourth category of the vaccine, which is nucleic acid based vaccine. The only major concern with this vaccine is that the technology that they're talking about it has never been placed to test. It has never been tested before. They are just, it's like a, what do you call that? It's a big uh, stake they're taking. But it seems to be working really well in the lab, and the hope is that it works the same way in humans. And
Mm.
because of this reason, FDA actually allowed them to skip the animal testing for this vaccine, which is also another concern that people
Mm.
have right now.
So, what is your take on the currently, because we lack of the treatment and lack of vaccine, what we have decided as a community, as as a nation, social distancing, and it's like week 6 of that, and people are getting a little bit sort of worried about the situation, a little, crazy, stir crazy is the term they use, or antsy, and they say, okay, let's start reopening. But this is working. The social distancing is
It,
working,
it is.
and go well, so going back, reopening, like people are talking, so in stages, reopening in stages, just a few people, and maybe an antibody test, which they have been talking about, will be something which will help people to figure out which people can go back to workforce.
Mhm.
um, all right, so what is your message to the world right now, to everybody, you know
Well, obviously, my first message is that please uh, unite together. We have to fight it together. And I have been hearing a lot of news from so many other countries. I've not seen it here in the, but well, there have been some cases here as well, and that breaks my heart that we are targeting certain people, because they just happen to belong to some
part
region.
of the world, yeah,
So
yeah.
we should not do that.
Yeah, we should remember the virus has not, like, the virus does not discriminate. It does not
Virus
discriminate
and the
against,
disease does not
caste
discriminate.
or
There is
race or
no
religion.
region of a virus, right?
Yeah,
You have seen that. You're seeing that it is infecting everybody
anyone and everyone.
around the globe, right? Everyone is
Mm.
suffering.
And it could
So
have started anywhere, that's really not.
absolutely, and absolutely right now, and be positive. Don't panic. I know a lot of people, are struggling because of the lockdown, and I am. I'm in academia. I'm in academics. Whatever I was doing physically on the campus, most of the work I'm still doing it. It's virtual, like I'm getting my paychecks. It is not impacting me much. But there are a lot of people, they do not have this luxury, right?
That's true.
We should reach out to them. We should help them as much as possible. Because
Right.
we the lockdown is very critical at this stage, especially in the absence of a vaccine, in the absence of an effective approach to treat the disease, in the absence of other measures that we could talk about. So it's very important that we follow this lockdown, we follow the government guidelines, we follow the instructions the doctors, are recommending us. These are these are critical at this time. We should follow those and always keep in mind that there are certain people in the world who do not have, luxury like you and me. We should reach out to them, help them as much as possible. Some people actually, do not even have food, you know,
Yeah.
on
Yeah.
their plates. So that's what we need to do. And
Yeah.
yes, follow the general guidelines. I'm telling you, it's not rocket science. Just use common sense. Don't go out, don't go in groups, don't, uh, touch,
Just
random
the necessary
places.
precautions.
Yeah,
Yeah.
sanitize your hands all the time. Do not touch your hands to your face. And,
Mm.
yeah,
And take one day at a
follow
time,
social
right?
distancing. Yeah,
Yeah, since we don't know anything about this,
we don't know anything
we
about it.
don't know future of this, just one
Exactly.
day at a time.
Right. I just want to
And
add that don't
while
panic.
the authorities are while people are finding out there, people are working round the clock to find a treatment, to find a
Absolutely.
vaccine. This is our support as a community.
We need to support, as we have uh, some resources, some tools, some luxury available to us. So we should use those resources to help other people who do not have those resources. I just
Yeah.
wanted to add at the end that please don't panic. I mean, I know it is something so new and unexpected. It happens all of a sudden. It falls down upon us so quickly. But it's because we don't know much anything about this virus as well. We know very little about this virus. We have to learn a lot more. So uh, a lot more people die with flu alone itself. A lot more people die with cancer. A lot more people die with cardiovascular disease, right? This thing is so new. That's why we need to take some precautions. Support the healthcare providers. They are the front line. They are at the
Right.
front line. They are at the highest risk. We need to support them instead of criticizing them. They are working day and night. So this is one of my key
That's
messages I
true.
wanted to give.
We are human beings, and being human should be our nature, and we should, in these times, support each other. Absolutely, your message is well taken. Thank you so much, Dr. Shahid, being with us and sparing few minutes to talk to us. Thank you
Thank you
very
so
much.
much. Thank you so much for giving me this opportunity. I loved it, and I hope you stay safe and stay well.
Stay safe. You too.
Thank you. Bye bye.